As I would imagine by now, most or if not all of you know, Radiesse was approved for hand injections. Radiesse is the only filler that is approved for hand injections. And while all the fillers, I think, have been used for hands, and there have been articles written especially about polylactic acid Sculptra. I've seen hands done. I wrote some of those articles. I've seen hands done with different hyaluronic acid fillers. We've also, I think anything can be put in the hands. Fat can be put in the back of the hands as well. The only product that's FDA approved is Radiesse, and so my recommendation would be that I would use Radiesse for hand augmentation. And that's what we're going to demonstrate today. This is part of the CME program, so although this program is supported by Merz Aesthetics, this is not a sponsored promotional talk. And what I'm doing is I'm going to use a cannula, which I believe, we just had that wonderful, very elegant presentation by Dr. Karimi on the use of cannulas and why cannulas have certain advantages, and I'm a big fan of cannulas. The approval for hands was not with cannulas, so technically this is off-label. I believe that cannulas provide patient safety. They hurt less, they cause less bruising, and you're less likely to injure anatomy in whatever area that you're injecting in. So we're going to do cannula. We had a little bit of topical anesthetic on that we've wiped off, and we've prepped the hands. We've used a little bit of a HiPAA prep in this case. And and this is an optional step, I have a little bit of lidocaine, and what I'm going to do is I'm just going to pick up the skin, just going to tent that up a little bit like that. You'll feel just a small poke here, and I'm going to put in just a couple of tenths of a cc of lidocaine right there. And the reason that I'm doing that is because the cannula, as we're all aware, is blunt, and the cannula will not puncture the dermis. So you have to have an entry port. We call it a pilot needle amongst other terms. So I have a pilot needle, and I'm using today, I have a 25 gauge, 2-inch cannula. So I have this little pilot needle, and what I'm going to do, right where I did the anesthetic, I'm just going to come in with this pilot needle. I see that little bleb right there, and I'm just going to make an entry port. I'll rotate that a couple of times. And the secret to looking good with a cannula is whether or not you can get it in the hole. Sometimes it's a little challenging. Fortunately, I have just a little drop of blood, and that allows me, and it is Halloween, so I feel like a vampire right now, right? All right, so that was actually very easy. So I have the Radiesse. Now what I've done is I've mixed the Radiesse with lidocaine, and actually mixing with lidocaine is on label for Radiesse. And what I do is I'm in that potential space, that loose areolar tissue, and I'm just below the skin, and I'm inserting that cannula. Does that hurt at all?
Pressure.
Yeah, kind of a little pressure, and that's common. And what I'm going to do is I'm very gently, I just bring that down, and then this is how you make a 2-inch cannula about 2.5 inches, is you compress the tissue a little bit. And then what I will do, and if you look right where my finger is, you see the product being injected. And what I'll do is I'll inject as I withdraw the cannula, and then I will come back again. And I'll find a nice vein. There's a vein right there. Watch as I sort of go and push against that vein. You would never do that with a needle, but the cannula just will make the vein roll out of the way. So your chances of getting bruising are significantly less with the cannula. And it hurts less. And this is a very, very nice, very fun technique. It's kind of an add-on technique. This is something that the patient may not come to your practice specifically for this, but while they're there getting other products or other procedures, if you have some in-office promotion, if you talk about it, what'll happen is that the patient will go, well, yeah, you know, my hands do look older than my face, and I would very much like, be interested in having something done. You can run hand specials where you might combine this with a little Fraxel or IPL or chemical peeling, or whatever kind of resurfacing. There's lots of different energy-based procedures that we do on the back of the hands for pigmentation and to help with the rhytids. Sometimes there's actinic keratoses on the back of the hand, so you may wish to do some treatment for those also. And then you fill up that atrophy that develops with age. The tendons become exposed, and basically the hands thin out, and that's what, remember the old Palmolive dishwashing liquid with, I think it was Maud, and someone was soaking their hands in Palmolive as they were getting like a little manicure, and say, don't let your hands give your age away. So there is a nice vessel, and I'm going to rotate your hand ever so slightly. There's a nice big vessel right there. And so the tip of the cannula is just pushing up against that vessel. Hope you all can appreciate that. And it'll slide right under it or over it. It'll just go away. Now, again, that's not to say that you can't get a bruise, and never tell the patient that they won't bruise with the cannula, but you are much less likely to get a bruise. Now, credit for this technique generally goes to Mariano Busso, dermatologist in the Miami area. And when we originally were doing the technique, his approach was he would drop the entire syringe in a single bolus in the back of the hand and massage it around. And you know, the first time I saw that, I thought, oh no, you know, Mariano, what are you doing? And that's never going to smooth out. And then within a few moments, he would just massage it out. So it was really, really interesting to see that. What we've done, that was with a needle. So what we've done since then, as we continue to refine techniques, is we use the cannula, and we sort of come back and forth, and we very, very gently just fill up that whole back of the hand. And I have used now almost 1.5 mLs of product. It's typical to do 1 syringe to the back of the hand, and that is the entire syringe. If you notice, Yvonne has her hand on a ball, and what I like is that it gives them something to do, and it also helps to slightly flex the wrist. And then what we do is we just kind of come back and forth. Your staff can do this. You can use a little, like a little Cetaphil cleanser. You can use some ultrasound gel. There's a variety of things that you use. And you just sort of massage that around, and what'll happen is that product, it just distributes itself beautifully. And then what I usually have the patient do is when I move to the second hand, I'll say, just sit on your hand. I'll have them just put the hand, we'll put a little gauze on top, put the hand just right under the buttock, and after we massage it for a moment, I do the other hand. So you can see it's very quick. This is a bony prominence here. This is not product. So all that product is very nicely smoothed. The nice thing is you will not get that Tyndall effect from the Radiesse because it's not a hyaluronic acid, it's not binding water. And I've seen the Tyndall effect in the back of the hands, especially with Voluma, and I don't know why that more than others. I've seen all the HAs in the hands. Of course, that's really only a concern if you're very fair-skinned. But if we take a look, and I hope that projects well, and you can see the, and the reason I say I hope rather than as you can see is because I have my injection glasses on, so I can't really see that screen very well. But does it look like it's in focus? Okay, good. And can you appreciate the difference? And it's pretty striking. It's an aha for patients. They love it. And what I like about the cannula technique, in addition to, I don't see any bruising, you're more likely to get bruising from the pilot needle entry than you are from the cannula. But the cannula technique also, there's only one percutaneous puncture. And classically, if you're using a needle, you're going to have 3 or 4. And of course, every time you puncture the skin, you run the risk of infection. And you know, we don't want infection in the back of the hand. Obviously, don't want infection anywhere. But I like the fact that we only have the one tiny little poke in there, and that hand just, just, you know, really nice difference there. So because as you heard this morning from Dr. Rivkin's presentation, because the calcium hydroxyl apatite has a neocollagenesis effect, it's going to stimulate collagen, and again, no discoloration, and And Radiesse as a tissue accommodation reaction doesn't make nodules, papules, or granuloma. You saw that in the presentation this morning. And that was one of the problems with the PLLA in the back of the hands was nodules and papules. So that's why I think this is an idealized product. It's on label. I prefer cannulas. And if you haven't done this, I really, really think you need to give consideration to that in your practice. How many people are using Radiesse in hands? Just kind of raise your hands. Oh, good, good. Looks like the Merz people are doing a good job. Does anybody have a question? If you do, kind of yell it out, because I probably can't see you raising your hand. So.
One question here.
The question is, do I add lidocaine to the Radiesse Plus? Well, Radiesse Plus has lidocaine in it. So it is up to you if you want to add additional lidocaine, which tends to thin out the product a little bit, can make it a little bit more malleable within the tissue. When I use lidocaine in the back of the hand, I use lidocaine plain. I don't use lidocaine with. Not that I think that there's necessarily anything wrong with that. It's just what I do. But bleeding with cannulas is not really an issue. You don't really need the epi. Another question? No, not at all. The question was, have I had any trouble with Radiesse hardening in the syringe? Not at all. So it was a 25 gauge cannula by 2 inch. What size you use is really personal preference. I like the 2 inch because on the average size hand, I can go from one of the extensor creases at the wrist all the way down to the carpal, the knuckles, the carpal to the phalanges joint, and I'll massage it right in between there. So that 2 inch cannula works well for me. You can use a 1.5 too, and just use whatever you want, but there's certain utility, and I think that's ideal. And I think we have some cannula exhibitors here, and if you're not using cannulas, I would take a moment to talk to them.